I am very, very excited to share with you all today about how to prioritize mental health and well-being in workplace culture, a topic that is very dear to my heart. So let's go ahead and dig in. As Heather mentioned, I am Tara Davis, and I'm Director of Internal Comms and Staff Wellbeing and Engagement at the American Psychological Association. So what are we going to talk about today? First, how are we doing really? I'm going to share some findings from APA surveys. We're going to talk about APA's psychologically healthy workplace model, which we use to create a work culture prioritizing mental health and well-being. And I'm going to talk about ways to communicate creatively and intentionally, particularly in a virtual or hybrid workplace. And then we're going to turn to what specific actions that leaders can take and give you some takeaways that you can implement at your own organizations. And as Heather mentioned, we will have time at the end for Q&A. Okay, so we're going to start with a question that you can actually put your answer in the Q&A box. So I would love to know, is your stress level higher than it was pre-pandemic? And if your answer is yes, how do you see that showing up in your life? How do you notice that stress? And if your answer is no, we're going to end the webinar right now and you can tell us all of your secrets. All right, so put your answers in the Q&A. Let's see. Tell us if your stress level is higher than it was pre-pandemic. Yes and no. Got another couple more yeses. Higher, yes, higher. Conflicts with differing opinions, re-pandemic safety. Certainly heard that. Higher due to working more hours. Higher, I work in healthcare, definitely. You can see it in my mood and my patience. Agitation. All right, someone said no, made changes during the pandemic. Would love to hear more that you can share later in the session about changes that you've made that have helped. All right, so it looks like overwhelming majority said yes. And to those that said no, I really want you to contact me afterwards and tell me all of your secrets. And so our next question, and some of you alluded to this with your first answer, I would love to know, have you taken intentional steps to manage your stress level? And if so, please give us an example of what you've done. So lots of sleep, that's awesome, really important to our health and well-being. What else? Administrative nightmares. I'm seeing more about being more sedentary, weight gain. You're not alone. That's definitely something affecting a lot of people. Get away from desk and take a walk. Love to hear that, Diane. Taking those healthy breaks is really important. Someone else said more walks outside, reading more books. These are awesome ideas. I no longer have a 2.5-hour commute every day. Yes, that's a fantastic bonus. Self-care, efforts at acceptance. These are wonderful. And I am so excited. Travis is capturing these for us that hopefully we can compile and share out with you so you can get other ideas from your colleagues. So thank you so much for being vulnerable and sharing what your journey has been like. So I'm going to share some data with you from APA, and I just want to give you a glimpse into what our country is dealing with. So a little bit of context, I'm going to reference the Stress in America survey. And so this is a survey that APA has been doing since 2007, and it measures attitudes and perceptions of stress among the general public and identifies leading sources of stress, behaviors that we use to cope with the stress, and the impact of stress on our lives. So there's typically about 3,000 adults surveyed when we do this survey. And before the pandemic, it was done annually. And due to the pandemic, our team has been doing these surveys more frequently. So in 2020, APA issued a warning that the impact of stressful events of the pandemic has a long-term effect on physical and mental health. And the warning is that, there's a second pandemic, one that would persist even after the physical threat of the virus had been addressed. And our follow-up surveys have unfortunately indicated that this has come to fruition. So I'm going to mainly focus on our most recent survey, which is really good timing as the results just came out. And so adults were surveyed in late February and a little bit in early March. And so obviously we all know this is 2 years after the World Health Organization declared COVID-19 a global pandemic. So inflation, money issues, and the war in Ukraine have pushed our stress levels to alarming levels. More adults rated inflation and issues related to the conflict in Ukraine as stressors than any other issue that has been asked about since we began the Stress in America survey in 2007. Related to that, stress about money is the highest recorded since 2015. And, it actually seems a bit lower than this group reported, but 41% of US adults say the level of stress in their lives has increased compared with before the pandemic. I find this statistic really fascinating, although the majority of US adults agreed they're not scared about getting COVID as nearly as much as they were in the beginning, which makes sense. Close to 3 in 5 agreed that the pandemic is still overall a daily stressor. And close to 2/3 of adults said that their life is forever changed by the pandemic. I want to highlight 2 specific bars in this chart. So 87% say it feels like there's been a constant stream of crises without a break over the last 2 years. I'm sure a lot of you can relate to that. And 73% agree they're overwhelmed by the number of crises facing the world right now. So what that indicates is this compounding level of stress and this compounding pressure that just keeps building up and certainly has an impact on our mental health and well-being. So how are we dealing with this? Well, a lot of the ways that we're dealing, unfortunately, are with unhealthy coping behaviors. And these unhealthy behaviors have persisted through the second year of the pandemic, suggesting that these coping mechanisms have become entrenched in who we are. And, that a lot of us have mental and physical health decline as a result. So in terms of weight, close to 3 in 5 reported experiencing undesired weight changes. And among those who gained more weight than they wanted, the average amount of weight gained was 26 pounds. In terms of alcohol, more than 1 in 5 Americans said they've been drinking more alcohol, and those who have been drinking more are consuming an average of 10 drinks per week. Someone mentioned in the chat decreased exercise and activity, and you're not alone. It makes a lot of sense. With going virtual, there are less opportunities for natural exercise. We're sitting more. We don't have that commute, but a lot of us made up for that commute time with working more. So we're sitting more, and a lot of gyms closed because of the pandemic. People had these behaviors in place to care for their health, and they went away. So close to half of the adults who responded said they have been less active than they wanted to be since the pandemic started. This is a really striking statistic that kind of haunts me. 64% said they feel the pandemic has stolen major life moments that they will never get back. And nearly half of Americans agreed that they felt very lonely during the pandemic, which again, it makes sense when we think about it, because most of us, this is the longest break that we've had from seeing family or friends in our lives. And I want to talk a little bit briefly about pandemic parenting, which I can certainly relate to. My son was born just 4 short months before the pandemic began. And so the majority of parents reported concerns regarding their children's social, academic, and or emotional development, and even more reported concern about the pandemic's impact on their child's cognitive development and their physical health and development. And then certainly we could dig deeper in how much the disruption of their child's schedules due to the pandemic has caused stress for adults, the fact that the rules change constantly for testing and for how you handle being exposed in terms of daycares being closed and schools. So all of these things are stressing out parents as well. And then this is, I believe, our last slide about Stress in America findings. So nearly 2/3 of adults said that the pandemic makes planning for the future feel impossible. And that clearly has a negative impact on our mental health because we can't really see positive things to look forward to. We can't actually envision that things will be better. And so that we aren't allowed that break from it being hard right now. Sometimes when we go through something really hard, if we think about the future and we think about how things will be better, then it can help us get through that. But in this case, we're saying we're not even able to plan for the future. And then 1 in 3 Americans said sometimes they're so stressed about COVID that they struggle to make even basic decisions like what to wear or what to eat. And then it's also important to realize that there are populations who are disproportionately being affected by the pandemic. And over the past 2 years, we've seen that younger generations, Latino adults, and parents have consistently reported more stress than others. Okay, so we've talked about what it looks like for the population, for Americans. And now I'm curious how you've seen it in your workplace as leaders in your organization. So our next poll question for you to answer in the Q&A is, have you seen evidence of elevated stress among your workforce due to the pandemic? And if your answer is yes, how have you seen it showing up? What are the behaviors? What are the symptoms? What is indicating to you, hey, our workers are more stressed? So go ahead and throw some answers into the Q&A. Yes, in all caps. Let's see what some other folks say. No one wants to return to the office. Yes. More employees taking leave for mental health issues, anger, workplace injuries. Employees overreact quickly due to the pandemic occurring. They're not wrong. Values have completely shifted. So many staff have chosen to either change careers or put them on hold. Wow. Short temper, foul language. Yes. Struggling with returning to work, employee morale. Early retirements. Not working together like they used to in the past. This is really, really fascinating. Increased anxiety, panic attacks, FMLA for mental behavioral health. Balancing being back in the office, but no one wants to be there. Lack of motivation. This is really great. Thank you again for being vulnerable and sharing your experiences with us. So again, would love to know, has your organization taken any steps to address this increased stress? And if so, can you tell us an example? So would love to know, has your organization taken concrete steps to address this increased stress? And if yes, then tell us something that you've done. This one's requires a little more thought. Asking if people are more stressed. The answer was very an obvious yes, but give you all just a minute to put answers in the Q&A. Unemployment caused by the pandemic has made work-related stress much worse. Education sessions, but this person noted they're not well attended. Can relate to that. Monthly wellness webinars. Ooh, regularly promoting our EAP. We're going to talk about that. That's a great one. Holiday party. Flexible hours and working remotely. That's wonderful. group sessions with a therapist without senior leadership involved. Love to hear more about that. At the start of the pandemic, a portal was created to share pictures from around the world with colleagues. That is really fascinating and unique. Routine messaging on communications boards, giving them tips. I love that. Social gatherings after work. I want to hear more about that at the end, because something I've been seeing is, a lot of employees don't want to do those things after work because they're just overwhelmed, and they end up just, wanting to be done with work and go spend time with their family or friends. So I'd love to hear more about that at the end. Okay, great. Thank you again. Thank you so much. This is really helpful, and I love reading what other folks are doing. So now we gave you the data from Stress in America about US adults, but now we're going to turn to the workplace. And so APA also does a work and well-being survey with the US workforce. And I think that we started in 2017. And so the 2021 survey, here are some findings. More than 2 in 5 working adults said that they intend to seek employment outside their company in the next year. So we've heard of the Great Resignation. So there is the data showing it. And a lot of you put that in the Q&A box, that a lot of resignations, a lot of turnover. I find this one even more striking. So those who typically feel tense or stressed out during the workday are more than 3 times as likely to say they intend to seek employment elsewhere. So this is a great reminder that caring about your employees' stress, caring about their well-being is not just a fluffy thing to make your employees feel good. It actually is good for business. So here were the top stressors that our respondents reported. Low salaries is always at the top, as you can imagine. Long hours, which some of you put in the chat. Lack of opportunity for growth or advancement. Lack of involvement in decision-making. And then 2 more that were reported more so than in the past were heavy workloads and unrealistic job expectations. So the question is, what can we do? What can employers do? What can the workplace change to make this situation better for employees? Well, here's what they said. Employees, the vast majority, said that they think actions from their employer would help their mental health. And here are the things that they cited. Flexible hours, which a lot of you mentioned, so kudos. Encouraging employees to take care of their health, encouraging employees to take time off, and encouraging breaks during the workday. So kudos to those of you who said that you're managing your stress by taking walks or breaks during the workday. So obviously, America's mental health is in crisis. And as leaders in our organizations, it's our job to ensure the well-being of our employees. The workplace is where people spend most of their time. And so it's a critical point for intervention for employee mental health. So I'm going to share with you a model that we use at APA in order to prioritize mental health and well-being in the workplace. And I'm going to give you some tangible examples of how we implement this. And just keep in mind that not all of these are going to work exactly for you, but the idea is to think about these science-based factors and how you might be able to employ them in your culture. So this model is our essential components of a psychologically healthy workplace. And so these 5 domains are, the research shows are contributors to employee well-being. So if you focus on these 5 things, then you will have greater employee well-being, which we know affects organizational functioning. And we'll talk a lot about communication as well. So these are essential components to what makes up a mentally healthy culture. And we use these to guide our practices at APA. We have a science-led, empathy-based approach to how we practice employee well-being. So I'm going to go through each of these. So Employee involvement is about fostering creativity and autonomy of employees and encouraging involvement in organizational decision-making. And so this was one of the top workplace stressors in 2021. If you go back to that slide, you'll see that employees said that they didn't feel involved in decision-making and bigger parts of the organization's culture. So what can we do? Well, the most important thing is that employees feel heard, and there are lots of ways to do that. An annual engagement survey, intermittent pulse surveys, focus groups about the future of how your organization will function and how it will work. Those are some things that we employ. We also invite our employees to be the MC of our all hands meetings or holiday parties, rather than the CEO, because we want to give them those leadership opportunities. It means involving employees in decision making. We went through a very thorough process to figure out what our workplace looks like as we come out of the pandemic. And we invited employees to be involved in a number of different ways. And we took their feedback and formed our decisions based on it. We have weekly listening sessions with our CEO. We call them Coffee Tea with Arthur. And it's a great spot for two-way communication, for him to share important updates directly to employees and for employees to ask him any questions. And of course, check in with your employees often, because our world is ever changing. And there are a lot of stressors in the world right now that are certainly impacting employees as they work. So I do want to highlight a couple rules of feedback that are important. One of the worst things you can do in an organization is to ask for feedback and do nothing with it. That actually creates distrust in the organization. It doesn't mean that you use every terrible idea. I'm sure we've all had a lot of those. But you should at least be considering what was shared in order to inform your programs and your leadership decisions and your communications. Maybe you don't do the exact thing that they suggested, but you look at what's behind that suggestion and you try and provide something that will get to that sentiment. So the other piece that's really important is to show and tell your employees how you are using it. So for example, we received feedback from staff that while our employees mostly want to be virtual, some of them would benefit from having hoteling space in our building. So we set up a 3-month pilot program, and that's great. And if you're doing those things, that's wonderful. But it's really important to do the next step, which is communicating. You said that this would help you, so we are offering it. We are making changes because you suggested them, because you are an important part to this organization's success. That creates ownership and investment in the company. A lot of times we're in our own worlds and we think, well, obviously I changed that because they said that. But we need to remember that they are not following that same line of thinking. And we need to remind them that it's because of their input. So let's talk about employee recognition. So it's great to have a combination of monetary and non-monetary awards in response to significant achievements. It's great to have some elements that are formal and some that are informal, but it's most impactful when it's timely, personal, specific, and performance-based. So my first suggestion is to find your organization's duck. Rubber ducks may mean nothing to you, but to AP employees, they're a sign of appreciation and kudos. One year, many, many years ago, we decided to give out rubber ducks at an event. And I guarantee if we were still in the office, you would see rubber ducks aligned on every windowsill. And even when we're virtual, people have loved receiving an email that has an image of a duck, even if that's something they could create themselves. Because at APA, that means you did a great job. I value you. So find your organization's duck or create your organization's duck and name it and invite your employees to embrace it in the culture. Gradavid is a wonderful, wonderful video platform that we have been using during the pandemic. It's very easy to use, it looks beautiful, and we've been using it for recognition by having supervisors record a video, and we can request it on our end, so it creates very little effort for them. And then the video recognizes their employee who received the award. So they create the video, we send it, and the employee gets this great video from their supervisor saying, awesome job. Especially in a virtual environment, that is a great thing to receive as an employee. We're also using Gradavid to welcome new employees to the organization. Employees who started while we're virtual, I'm sure, feel very lost, and we've heard feedback that they are just having trouble meeting people. So we started recording, asking them to record who they are, how their work relates to other employees, and something personal about themselves. And then we've been sharing it across the organization. And it's been wonderful to see the emails that they receive from others welcoming them. We have about 550 employees, so it's easy for a new employee to get lost in a virtual environment. But these are things that even if you are in person or hybrid, it could be a great solution. And then, of course, I mentioned it's great to have formal aspects, so departmental and organization-wide awards. So we have a formal structure for awards for our organization as a whole, but then each major unit also has a budget for awards that they can give out to their employees. And then you see some good news here, and I will fully admit that I borrowed that from John Krasinski during the pandemic. It just felt very dark for a long time, and it still feels dark for a lot of us. But we wanted employees to have a way to celebrate the good things happening in their lives, whether personal, whether professional. And so we started something called Some Good News, and we invited employees to send in pictures, and we include them in our daily email, which I'll talk about in a moment, and on our intranet. Okay, employee growth and development. So these opportunities enable employees to expand their knowledge, skills, and abilities and apply competencies they've gained to new situations. This was also one of the top workplace stressors in 2021. So obviously, we think of growth and development. It's like training, money. I may not have the budget for that. And those are certainly valuable growth and development opportunities, but there are lots of options that are free and do not require training. So one thing that we try to do a lot at APA is connect the dots for staff between their work and the organization's overall impact. Sense of meaning is really important, and it's important for engagement. So connect that person who may feel like they're just pushing papers to the big impact that the organization's having and the way that their work is leading to that. People who are more connected to your mission are more invested in the organization and have greater engagement in their work, and they're more productive. So you'll see at the bottom, this is an item that we shared in our daily email to do something like that. And it's a video of our impact from last year so that employees could see that the work that they do matters. Also, empower your employees to have a conversation with their managers about goals. And it's, it'd be great to have some of the goals be about their growth and development, not just a specific task. So who they want to be as an employee, who they want to be as a leader. We have a leadership academy that is open to all, and I actually am in the cohort happening right now. And one of the greatest things is there's a 360 review that doesn't go to your boss. It's not part of your appraisal. It's just to help you grow as a human. And I've already taken away so much from that. There's also a mentoring component with a coach. Okay, so we have two more domains we're going to talk about. One is health and safety. So this is promoting healthy behaviors alongside prevention, assessment, and treatment of potential health problems. So I think pre-pandemic, we really just thought about the health piece. And maybe some of you work in situations where there are, workplace injuries. So safety's been on your mind all along. I know someone put that in the Q&A. But for us, it was really about health. With the pandemic, obviously safety became a major component. So we're going to talk a little bit about that as well. So when people first think of health, they always think of physical health, and that's natural. And it is important. There's great research around the importance of physical health and your workday. Employees who spend 2.5 hours a week being physically active are more satisfied with the quantity and quality of their work. They report increased workability and take less sick time than employees who do not engage in any physical activity. Also, people who take short breaks are actually more productive and more able to focus on a task for a prolonged period of time than people who do not. So again, shout out to those who said that you're taking healthy breaks during the workday. So this is obviously even more important because we're sitting more than ever, as we mentioned. So definitely keep in mind physical health, but it's not just about the physical health. And I work at the American Psychological Association. So mental health is something obviously that we focus on a lot. But I think it's very important to have a holistic view of well-being. It's also emotional well-being. It's also social well-being. It's also financial well-being. At APA, we had a session on estate planning this week, and that was really helpful to me. I learned a lot, and that really fed my financial well-being bucket. So it's important to see it holistically, that it's not just physical health. Mental health is very important, as well as these other parts of our well-being. And so, we offer ClassPass for our employees to take a break throughout the day and health and wellness challenges. A big thing for us is normalizing teletherapy and EAP usage, which some of you mentioned in the chat, which I really appreciate that you're getting, giving tips to employees on accessing that amazing benefit of your employee assistance provider. Our CEO has talked about this before, and how we, for physical health, we go get a physical, and we never think that we should only go if something's wrong. But that's how we treat mental health a lot of times, is that we only should go if we need to or if something's wrong. But it's really healthy to think of mental health as, a way. Investing in your mental health is a way to perform at your best. It's a way to be your best self, to get ahead of any issues that could come up later. So normalizing taking advantage of mental health benefits. And then a big one during the pandemic has been eliminating uncertainty wherever possible. COVID has been so scary for a lot of reasons, but a big piece of it that makes it more frightening than, say, the flu is this loss of control and so much uncertainty. So whatever we can do as leaders to help employees control more things, or to just feel more of a sense of control. So for example, our leaders let us know about decisions related to telework well in advance, related to vaccination policies, or any going back to the office. All of those things are communicated well in advance so that our employees feel that there is a tiny bit that they are able to control and that is certain. You can see here, this is again from our daily email, us talking about teletherapy in a video with one of our psychologists, and normalizing and sharing how people can take advantage of that great benefit. Something else that we created during the pandemic, we kept hearing the word overwhelmed when we would ask employees how they're feeling. So we created a hub on our intranet that has resources if you're overwhelmed about this or that, and ways that you can get help. So I have to talk about this as something I'm very passionate about lately, and this is on my mind lately when I think about health and mental health in the workplace. So weekly meeting time has more than doubled for Microsoft Teams users since February 2020. Teams chats per person are up 45% and climbing, and there are 42% more chats being sent per person after hours. So this is according to Microsoft's 2021 Work Trend Index. So nonstop video meetings can also have, research has shown, can have negative effects on cognitive load and well-being, particularly for new employees and for women. So I'm using this example for health and safety, but you can see that there's a lot of overlap. This is also a great example of how you can involve your employees. Our employees kept saying, I'm exhausted from the meetings. My meetings are ineffective. I'm in meetings all day. I can't get my work done. And so we're doing something about it, and we're letting our employees know they're heard and that they're part of the decision-making process. So we started a Meet with Purpose campaign at the beginning of March, and we're going to have 4 phases of aligned, intentional behaviors to improve employee well-being and organizational impact. Right now, we're on purposeful meeting invites. So we're starting very tactical. All meetings should end at 25 or 50 minutes after the hour, and they should all start on the hour or the half hour. And the reason is to create those breaks, create reset time, create space to hug your dog or hug your child or walk outside. Meeting invites should also specify if they're audio only, video optional, or video encouraged. We were pretty much, an in-person organization. If people worked at home, they didn't have meetings that day. So when we went remote, it was like, okay, I'm used to seeing you face to face. Now everything will be video. But we're realizing that not everything needs to be video. And there's actually science on when it makes sense for a meeting to be video and when it's actually possibly detrimental for it to be video. So giving our employees the best practices for that based on science. And then meeting invites should include an agenda or a desired outcome. And then you can see the other campaigns that we have coming up for the rest of this year. So this is a way that we are currently caring for our employees' mental health and well-being. And then the last domain I'm going to talk about is work-life harmony. It was called work-life balance before, which, let's be honest, was always a joke because there was never a balancing act. It was never like at the end of the week, you worked the same amount as you spent with your family. That was never the case. So we've been calling it work-life harmony. And this is acknowledging employees have responsibilities and lives outside of work and helping individuals better manage those demands. Because when there's a conflict between our work responsibilities and our life responsibilities, it can diminish the quality of both work and home, which can affect your productivity and organizational success. So again, not just good for the employee, but good for your organization's functioning. So my number one thing I want to say is see your employees as people first and producers later. That is the empathy-based approach that we take at APA. And there's no separation between work and life. It's all one gray area, and we're all doing our best. So understanding that your employees are playing multiple roles right now and that it's a very weird, difficult time. One thing that we do is we provide mental health days. And you might say, we have a lot of PTO. Why would I need to offer that to our employees? Well, we might say the same thing. APA, fortunately, has a great PTO plan. However, what we learned from our employees is that a mental health day is so much more meaningful because everyone is off on that same day. And as you can see from this communication that we sent out, our CEO said no one should be working, no one should be emailing. And so, oftentimes I go on vacation and I come back and I dread it. The vacation glow is gone after a day because I have thousands of emails to weed through. The beauty of a mental health day is no one worked, so there's nothing to come back to you on, the next work day or on Monday. Just checking my time here. Don't mind me. I'm going to turn off my alarm. And so this is a great thing where this is where it shows that it's not even just about offering something. It's about the communication around it. It's about advertising it well in advance so employees can take advantage of it. So that's something that APA has been doing. We offer, I think last year we had 4 or 5 mental health days throughout the year. And then supporting staff in establishing their home office. It's like, for us, we had to kind of think about the hierarchy of needs. A lot of our employees work in small apartments, or maybe they don't even have a door to their office. We're in a metropolitan area. And so helping those employees set that up, because if you don't even have a space to work, if you don't even have the things that would help you do your job well, then how can you think about these deep work concepts clearly? How can we expect you to do a great job at work? And then flexibility with when and how employees work. A lot of you mentioned this in the chat, so I'm very impressed that you're doing that. Being flexible with start and stop times. Don't be mad if people are able to multitask. Be impressed. As long as they are focused, they can fold their laundry at the same time. And then, setting delayed send for emails outside of working hours. So all of those things that are about flexibility with when and how employees work, and being respectful that not everyone is operating on the same schedule right now. Creating forums for staff to process major societal events is something that we've really focused on over the past couple years with our EDI office, and just giving staff the space when something really horrible happens to process it aloud with their colleagues, and to ask questions with a psychologist. And then sharing those mental health resources with specific populations. So, if they're if there's something happening in the world around you, and, it's affecting a particular group, like the LGBTQ plus community, then sharing mental health resources for them. Or, when school started shutting down, sharing resources for parents on how to balance working and, taking care of their child who is at school virtually. So sharing mental health resources for specific groups who need it. Okay, so social connectedness is not technically part of our model. However, social connection and support is critical to our well-being and for building resilience. It's a major predictor to our health. One of my favorite studies is the Harvard longitudinal study, What Really Determines How Long We Live. They looked at a lot of factors over the span of, I think, 50 years, and they determined that what really determined how long someone lived was whether they had one close person relationship that they could confide in. So the big question, especially at the beginning of the pandemic, was, what does this look like when we need to be socially distant, physically, which often means physical distance for our physical health, but we also need to connect with others for our mental health? How do we manage that? So we started to create forums specifically for employees to connect outside of meetings, and particularly creative forms of social connection that are not always Zoom. Because of, obviously, we've all been going through some Zoom fatigue, or whatever platform you use. So some of the things that we implemented, we have a virtual break room. And this is another great example of employee involvement. Employees asked for this. They kept saying, it was really great when we could run into colleagues in the lunchroom and talk about the book we read, but now we don't have an opportunity to do that. So we created it. And then not only that, but we allowed them to create the channels. And I think we started with maybe 2, and now we're up to 20. And so we're inviting our employees to take part in that. And then a couple other things, we have a Coffee Connections group where we set employees up with other colleagues across the organization and have a 25-minute social conversation. We also do one-on-one conversations like that. And something else that has been very popular during the pandemic is our question of the week. So we invite colleagues to respond to something. This was one of our most popular ones. What's something that has brought you joy in the past month? So it's finding those ways to create conversations that maybe were happening before very naturally, and now they aren't. And so giving the space for them. So I want to talk a little bit about communicating intentionally and creatively. And first of all, I want to be clear that it's not just about the tactic. I think we often start with, I want a video, and why do you want the video, and what makes the video the best way to communicate this message? So we always start with, what do we want staff to know, do, or feel when we think about internal communications? And then we think about, how can we craft this message in the organization's overall voice and to be consistent with our values and our priorities? And then we move to, okay, what's the best medium for communicating and reinforcing this? And hopefully it's a mix of both top-down communication from our leadership, letting staff know the things that are available to them and demonstrating their support and some modeling, combined with, insights from employees about their needs and their values and their perceptions. And then we think about, what does success look like and how do we measure it? And then, of course, always evaluating lessons learned. So we use a variety of mediums, and we communicate multiple times, even more so over the past couple years because of the data that we found about, decision making and how the pandemic is affecting stress levels and cognitive load. It's even more important to communicate in a variety of ways and multiple times. So these are some things we do. APA Today, as I've briefly mentioned before, is our daily digest. And we actually started this before the pandemic, and we send it out every single day. Our team, our small team, sends this out to our 550 employees, and it tells them what they need to know for the day. It might be policy updates, security training, tips about meetings, how to decide if a meeting should be audio or video. We highlight things that APA is doing that they should be proud of, the Stress in America survey. We have our question of the week. We talk about important issues to APA and things that are being shared in our journals, such as psychology's long journey toward racial justice. And then we have an opportunity for staff to know about staff changes. And we always include, especially since the beginning of the pandemic, one tip for their well-being that is based in science, and here's the science on it, and here's why you should do it and how you can do it. And then we always have a little spark joy Easter egg that is maybe a happy dog video, or maybe inspiring, like, someone who's accomplished something really incredible in the news. So that is our primary form of communication, and we send it out every single day, and all emails to staff are supposed to come through that unless they are from the CEO. And then we started doing something over the past couple months called APA This Week. And this was, again, in response to staff feedback. So they said, I'm really missing my coworkers. I have no idea what that person is up to. I haven't seen them in 2 years. And, this can also be the case if you are in person or hybrid, right? Because it's been a weird time. People haven't seen each other. So this is just a clip, little GIF example of what it looks like, but we use Grativid. And it's so amazing because employees get to share their work with the rest of the organization, and people get to see their faces. People include their kids or their pets or their plants. And it's just a great way to meet a lot of needs in the organization. So that's a way we've been inventive about sharing communications. We also have an intranet, and we use a version of SharePoint that is very easy to update. You can see this is our homepage right there. And we highlight things that are important for staff, and we always try and have a balance of things they need to know for the organization and also things to care for their well-being. So a couple other things I'll highlight. We do a lot of staff webinars. We do focus groups. We recently started a staff leadership team that is really focused on our strategic plan and helping staff understand tangibly how they can be implementing that and measuring that in their areas. We have town halls, and then one of my favorite things that we've done, and we just scheduled another one, is Arthur's Kitchen. So this is our CEO in his kitchen, and he made spaghetti, and he talked about cooking and used that as an analogy for the transformation of our organization. Employees loved it, and they have asked for it ever since. So it's just another creative way to communicate with your employees and have both top-down and bottom-up communication. So the last thing I am very quickly going to talk about, because we are about at our 10-minute mark, is an initiative that is coming up that I want to give you all a little teaser about. So we've talked about workplace culture, but what are specific actions that CEOs and other leaders can take? What are specific things that they can go and do that will make their workplace prioritize mental health and make it more psychologically healthy? So our CEO, Dr. Arthur Evans, is a member of a group of CEOs for some of the largest nonprofit member associations in the US. So together, this group has been addressing significant health-related issues impacting Americans. The current effort is a call for a major culture shift in the workplace in terms of how employers view mental health. So they have created 6 actions to improve mental health in the workplace. And they're going to be sharing out more resources and tips leading up to Mental Health Month in May. And so I want to share some of those with you right now. And if you'd like to be kept up to date on this effort, then certainly you can share with me your contact info, or I can share an email address so that you can stay abreast of what this group is doing. So the first thing is implementing flexible work schedules and hybrid work arrangements. We talked about that when we talked about employee health and safety and also work-life harmony. But a couple stats, 34% of employees say that flexible hours would help their mental health. So, you know, it's important to know that that has an impact directly on mental health. So take a look at what you require from your staff. And really, you know, our CEO always says, we're not going back to the office because there's no going back. So whatever it looks like moving forward, don't just do what you were doing before. Think about what is really required of your employees and whether you can be flexible in a way that will support their mental health and well-being. The second thing is re-examining health insurance policies with a focus on employee and mental health. So 53% of US workers are more likely to leave their job if they're offered a new one with better mental health benefits. So at a minimum, your organization's health insurance should reflect the mental health parity law, which requires health insurers to provide coverage for mental health, behavioral health, and substance use disorders that is comparable to physical health coverage. So that's the big piece. And then once your insurance coverage aligns with that, think about how you can remove barriers and think about how you can normalize taking advantage of mental health benefits. The third piece related to that is evaluating employee assistance program providers and ensuring they follow best practices. So 37% of employees say that employer-provided mental health resources can contribute to a better work environment, but very few employees actually use this benefit. So being creative, which one of you mentioned in the chat on how you promote this service, normalizing it. Also, you know, look for an EAP that really meets the needs of your organization. For example, what I love about our EAP is that when employees call, they are encouraged to request a counselor of a specific race, age, sexual orientation, or whatever it may be to better meet their needs. So that is a cultural competence piece that might be something that you're looking for. Number 4, we talked at great length about listening to what employees need. So I'm gonna bypass that. But don't forget, it's not just important to, you know, ask for their feedback and use their feedback, but it's important to close the loop by telling them that you're using their feedback and here's how. Number 5 is take a critical look at equity, diversity, and inclusion policies. So, you know, we know that providing an inclusive and supportive work environment is integral to a healthy work environment and the mental health of employees. Lack of equity and discrimination can contribute to stress and cause people to leave their jobs and have costly turnover. And so the data is clear that diverse companies perform better, especially when management is diverse. So it's very important to be thinking about EDI in every aspect of how your organization functions. And then the last piece that I'm going to end on is the action that you can take is to develop your own organizational process, program, or policy that supports a mentally healthy workplace. So as I mentioned at APA, we have these essential components of a healthy workplace, and it guides our science-led, empathy-based approach. This is not a one-size-fits-all solution for every organization, but what I've shared today and what I hope you take away is that there are steps we can all take to support our staff and create a culture that is inclusive and welcoming and healthy, both mentally, physically, and all the other holistic aspects of well-being. So we want you to just be thinking creatively about how to build a mentally healthy workplace. So again, you'll hear more about this initiative in the upcoming months leading up to May. But this is what I hope that you are able to take from today to form your own organizational process or program that will best meet your employees' needs and support their mental health and well-being. So that is all from me. And I have my contact info up here for anyone who has any questions and would like to follow up with me. But I would love to turn to Travis to see what questions we have.
Thanks, Tara.
Great,
sorry,
thanks,
I'm going to... go ahead, Tara. Go ahead.
I think Heather has some housekeeping before we dive into the Q&A, so I'll let her address that, and then we'll jump right into the Q&A section. Go ahead.
Perfect. Thanks, Travis. And thank you so much, Tara. I love the rubber duck recognition program. I think that was a wonderful idea. But thank you so much for all those insightful strategies. I just want to point out to everybody that you do have your credits are now available by clicking the yellow certificate widget at the bottom of your screen. Just as another reminder, we will be sending out the presentation slides and recording to all attendees by tomorrow afternoon. And now I'm going to turn it over to Travis for the Q&A.
Great. Thanks so much, Heather. And thank you, Tara, for such a timely and thoughtful presentation. I was furiously scribbling some notes on the Zoom etiquette, so I really appreciate that part. So I've been keeping track of the Q&A portion during Tara's presentation, but that is still open. So if anybody has any additional questions that they'd like to type in right now, we'll do our best to get to those. We're also keeping an eye on the timing since we are going to try and wrap up as close to 3 as possible. And if there's any elements that we don't get to in the Q&A, we'll also send those out. And actually, one of the questions that came up was in regards to sharing some of the recommendations that participants on today's call had in regards to managing and supporting mental health in the workplace. So we're going to do our best to compile that as well and go ahead and share that, with all the participants today. So I think one of the first questions that popped up here, I think it was in regards to the mental health survey that APA just recently completed. Was there anything that included in the survey why employees have been transitioning or seeking to transition into either new jobs or new careers, if any of that was captured in the recent surveys, Tara?
Yeah, that's a great question. So I'm going to push this, you all can see. So the biggest thing is that, employees who report feeling daily stress, I believe the stat is they're more than 3 times as likely. Let me push this one. Those who feel tense or stressed out, they are more than 3 times as likely to say they intend to seek employment elsewhere. So that's the biggest thing, is that daily, are they experiencing daily stress? And then we also had, these are our top workplace stressors that we compiled based on the survey results. So again, low salaries is pretty much always there in the US, so that's to be expected, but these other things are showing up more in the last couple years, and especially heavy workloads and unrealistic job expectations were not issues in the past couple surveys, and they are now.
Great, thank you, Tara. One of the other questions I thought that was really interesting that just came through. What are some suggestions for introverts to engage more in a work from home situation that seems to be, more in tune with, an extrovert type personality?
That's such a great question. And I do not envy introverts, especially new employees who are introverts, because it does feel that way. So I think that, the first thought when we're like, how do we engage with employees, is have an event, have a party. And that's certainly not going to work for everyone. So some of the things that we've done that have worked really well with introverts is one is that Coffee Connections group. We started out doing 4 or 5 employees would be randomly assigned together, and they meet and talk socially. And then I got an email from a new employee who's an introvert, and they said, that's kind of overwhelming. Like, what if we had one-on-one conversations? Just goes to show you, it's always important to assess your feedback, because I thought one-on-one would be really awkward. So then we started setting up one-on-ones, but making them shorter. So we call it virtual elevator combos. And we randomly set up 2 people, and we make it only 15 minutes so that it can't be that unbearable for a very long amount of time. So that's something. And then our question of the week has been great for introverts because they literally send us a question or send us a response with a picture, and they don't have to be on video. They don't have to talk to anyone. We literally put it up on the intranet page, and then we have, a comment section, and I can see employees forming connections based on that.
That's excellent. Another question actually that came up a couple times was around the Leadership Academy at APA. If there's any more detail that you could share around the Leadership Academy?
Yeah, I just started it, but the idea is that everyone in our organization will go through it. And two of the big components are the 360 that I mentioned. So I recently had 20 of my colleagues assess me, and it was so helpful because you have this idea of how you present yourself, but then to hear what other people see, and you get to rate yourself on all these levels of leadership, and then they get to rate you as well. And so that's a big piece because it's just for your own growth. But then there's also, they set you up with a coach, and you meet with them, I think, for at least 10 hours. The program started for me in March, and it's going to go through July. And we have a lecture once a month around areas of leadership, emotional intelligence, and what type of leader are you? Are you led by empathy? Are you led by, more authoritarian approach? So anyway, I'm certainly happy to share the company that we're using. I've found it really helpful so far. And the idea is that everyone is a leader and that we all have opportunities to lead in our sphere of influence. So APA is ensuring that all of our employees go through it.
Excellent. So just being mindful of the time, we did go a little bit past our 3 o'clock time slot. We do have a couple other questions here. A lot of them were around, specific platforms that are being used or some of those suggestions. And I do think we'll be able to capture a lot of that in our follow-up for today's session. So with that, I think we touched on the main topic questions that came up. But again, for everyone, please keep an eye out for the follow-up that Heather mentioned. And with that, I'm going to pass it back to Heather with just some closing comments. Thank you, everyone.